Good afternoon, dear students. The topic of our lecture is Diagnostic Capabilities of Laboratory and Instrumental Methods in Nephrology and Differential Diagnostic in Chronic Kidney Disease. Clinical Research Methods in Nephrology: Urine Examination, General Urine Test, Quantitative Assessment of Urine Sediment, Assessment of Renal Concentration Capacity, Microalbuminuria, Daily Protein Loss in Urine, Blood Test, Complete Blood Count, Biochemical research methods, blood test, total protein and protein fractions, urea, creatinine, uric acid, cholesterol or lipid profile, serum iron, percent saturation, transferrin, ferritin, and electrolytes. Clearance methods: Aerobic test, determination of glomerular filtration rate, uric acid clearance, electrolyte clearance, bacteriological examination of urine A, urine culture 3 times, general urine test, relative density of urine, reaction, proteinuria, glucose, urine sediment, leukocytes, erythrocytes, casts, salt crystals, other particles. Light microscopy, contrast microscopy, and polarization microscopy. Dry chemistry, urine testing. The results, we can test pH, protein, hematuria, relative density, glucose, ketones, urobilinogen, bilirubin, nitrates, leukocytes. General properties of urine: its color, reaction, transparency, relative urine density, and smell. The color of urine: pale urine, diabetes insipidus, and diabetes mellitus. Chronic renal failure: intensely colored urine, in fever, will be in fever. Hyperthyroidism, sometimes in tumors. Red urine: the presence of red blood cells. Free hemoglobin: under the influence of the activity of the urine, hemoglobin passes into methemoglobin. The staining of urine is dark brown color, myoglobin. Bright yellow urine, for example, it will be bilirubinuria. Drugs change urine color also. Amitriptyline in green, imipenem in brown, amidopyrin in red, chloroquine, riboflavin in yellow, furadonine in orange, aspirin or methyldopa in pink. Milky white color of urine, so-called chyluria, during the formation of a fistula between lymphatic system and the urinary system. Causes: parasitic, blockade of lymphatic vessels by parasites, filaria, for example. Non-parasitics. Non-parasitic, it will be in case of having tumors, injuries, and tuberculosis. Lipuria. Chyluria, also called Chyluria urine, is a medical condition involving the presence of hail in the urine stream, which result in urine appearing milky white. Reaction of urine: normally weakly acidic. pH is from 4.5 to 8.5. It depends on the food: meat, soy, vegetable, and fruit diet taking alkalizing agents, alkaline. Determination of the relative density of urine and osmolality of blood and urine. The relative density of urine determined using a urometer, but a more accurate method, determination of urine osmolality, according to the freezing point. In a healthy person, the density of urine depends on the amount of liquid consumed, perspiration, etc., etc. It is from 1.202 to 1.1030. Zimnitsky test. Zimnitsky trial is a urine test directed on the study of concentration function of the kidney. Usually this analysis is prescribed for chronic glomerulonephritis, chronic pyelonephritis, diabetes, non-sugar, hypertension. The main purpose of this analysis is to reveal the functional capacity of the kidney. Leukocyturia in the urine of healthy human beings in women up to 5 to 6 leukocytes in the pale in men from 0 to 1 in the pale view. The degree of leukocyturia determined using a sample according to Nechiporenko test. Nechiporenko test, laboratory testing to determine the content of 1 milliliter of urine white blood cell, red blood cells, and cylinders capable of evaluating the condition, the renal and urinary tract infections. Urinalysis Nechiporenko used to detect infection if in the clinical analysis of urine revealed deviations from the norm. Indications: hidden inflammation of the kidney and urinary tract, hidden hematuria, blood in the urine, monitor the effectiveness of the treatment. Types of urinary casts. Urinary casts can be divided into two main categories: acellular and cellular casts. Acellular casts, it's hyaline casts, granular casts, waxy and fatty casts. And cellular casts, it is red blood cell casts, white blood cell, bacterial and epithelial cell casts, urinary casts. Red blood cell casts form from protein and red blood cells erythrocytes. They often fail to be detected in the urine due to their fragility. Red blood cell casts indicate the renal origin of hematuria, red blood cells in the urine. They are found in acute glomerulonephritis, renal infarction, renal vein thrombosis, diabetic nephropathy, renal tuberculosis, kidney tumors. White blood cell casts are made from protein and white blood cell leukocytes. They are quite rare and are more common with acute kidney infections, for example, pyelonephritis. Epithelial cell casts are composed by exfoliated renal tubular epithelial cells. Their presence in the urine indicates pathological processes in the kidney. Most often they are detected in the urine in nephrosis and acute nephritis. Epithelial cell casts found in the urine within a few days after surgery indicate the rejection of the kidney transplant. Waxy casts and granular casts. Waxy casts represent the final stage of the generation of cellular casts. They are more retractive and therefore easier to see compared to hyaline casts. They are usually seen in tubular injury of a more chronic nature than granular or cellular casts, or like severe chronic renal disease and renal amyloidosis. These casts, Waxy casts, are also called renal failure casts. It's very important. Granular casts results either from the degeneration of cellular casts or direct aggregation of plasma proteins or immunoglobulin light chains. They have a textured appearance which ranged from fine to coarse of its characters. The appearance is generally more cigar-shaped and of a higher refractive index than hyaline casts. They are seen after uh, chronic renal diseases, acute tubular necrosis, strenuous exercises, etc. Hematuria is the presence of red blood cells in the urine. Visible hematuria, also known as gross hematuria, causes visible red or brown discoloration of the urine. Microscopic hematuria is invisible to the naked eye and it is often found by urinalysis or urine dipstick. It is said to be chronic or persistent if 5 or more red blood cells parallel high power field can be seen in three consecutive centrifugated specimens obtained at least 1 week apart. Proteinuria is the presence of excess proteins in the urine. In healthy persons, urine contains very little protein, as an excess is suggestive of illness. There are three main mechanisms to cause proteinuria: due to disease of the glomerulus, because of increased quantity of proteins in serum, overflow proteinuria, and due to low reabsorption of proximal tubulin. Albuminuria is a pathological condition where in the protein albumin is abnormally present in the urine. It is a type of proteinuria, and microalbuminuria is a term to describe a moderate increase in the level of urine albumin. Microalbuminuria, marker of vascular endothelial dysfunction, an important prognostical marker for kidney disease in diabetes mellitus and hypertension in post-streptococcal glomerulonephritis also. Creatinine clearance test is a waste product from the normal breakdown of muscle tissue. The creatinine clearance rate values are then calculated with healthy males usually showing values of 100 to 140 milliliters in a minute, while females show from 90 to 130 milliliters per minute. Estimated glomerular filtration rate is the best test to measure level of kidney function and determine stage of kidney disease. We can calculate it from the results of blood creatinine test, age, body size, and gender. Glomerular filtration rate tells doctors stage of kidney disease and helps the doctor to plan treatment. In glomerular filtration rate number, if glomerular filtration rate number is low, kidney are not working as well as they should. The earlier kidney disease is detected, the better the chance of slowing or stopping its progression. Here we have classification, the stages of chronic kidney disease according to the level of glomerular filtration rate. And according to this classification, stage 1, kidney damage with normal kidney function. Glomerular filtration rate is 90 or higher. Percent of kidney function is from 90 to 100. Stage 2 of chronic kidney disease. Kidney damage with mild loss of kidney function. Glomerular filtration rate is from 89 to 60, and the percent of kidney function is from 89 to 60. Stage 3A. Stage 3A, mild to moderate loss of kidney function. Glomerular filtration rate is from 59 to 45. The same is percent of kidney function. Stage 3B, moderate to severe loss of kidney function. Glomerular filtration rate is from 44 to 30, and the percent of kidney function is the same. Stage 4, severe loss of kidney function. Glomerular filtration rate is from 29 to 15. The percent of kidney function is the same. And the last, fifth stage of chronic kidney disease, kidney failure. Glomerular filtration rate is less than 15, and the percent of kidney function is less than 15. Here you can see normal estimated glomerular filtration rate according to the age. In adults, the normal estimated glomerular filtration number is more than 90. Estimated glomerular filtration rate declines with age, even in people without kidney disease. And here you can see that in age from 20 to 29, average estimated glomerular filtration rate will be 116. Talking about from 60 to 69 years, it is average estimated glomerular filtration rate is about 85. Visualizing research methods of the kidney can be divided into ultrasound, ultrasound of the kidney and urinary tract, ultrasound of the vessels of the kidney and urinary tract, X-ray, review radiography of the urinary system, expiratory urography and CT, magnetic resonance, MRI, and radioisotope renography, dynamic kidney scintigraphy. Indications for ultrasound of the kidney and ureters are pain in the kidney or in the course of the ureters, suspicion of a renal tumor, large kidney, non-functioning according to urography kidney, hematuria, chronic infection of the urinary tract, injury, suspicion of polycytosis, fever of unknown origin or postoperative complications, renal insufficiency of unknown origin, and schistosomacytosis. X-ray of the kidney, intravenous urography, radionuclide study of the kidney, magnetic resonance imaging of the kidney, MRI of the kidney. The most common indication for MRI of kidney is the diagnosis and staging of tumors. Usually the use of MRI is recommended as an additional diagnostic method if CT doesn't provide all the necessary information. The different diagnosis for chronic kidney disease includes the following conditions: systemic lupus erythematosus, renal artery stenosis, urinary tract obstruction, granulomatosis with polyangiitis, vaginous granulomatosis, acute kidney injury, Alport syndrome, Antiglomerular basement membrane disease, chronic glomerulonephritis, diabetic nephropathy, multiple myeloma, nephrolithiasis, nephrosclerosis, rapidly progressive glomerulonephritis. All these diseases it's necessary to differentiate with chronic kidney disease. And it's necessary at the end of the lecture to tell a few words about antiglomerular basement membrane disease. The disease is a classic autoimmune disorder characterized by the presence of circulating pathogenic autoantibodies directed against proteins in the glomerular and alveolar basement membranes. In the kidney, binding of these autoantibodies with the glomerular basement membrane disease results in activation of the complement cascade and can lead to rapidly progressive glomerulonephritis. Immunosuppression with high-dose steroids and oral cyclophosphamide together with plasmapheresis is used in the treatment of severe forms of this basement membrane disease after differentiation from chronic kidney disease. And thank you for your attention.